Well, coming up, September is Ovarian Cancer Awareness Month, a time to spotlight the symptoms and prevalence of this disease while supporting women in our community. Let's welcome Caroline Kittrell, board member of the Lowcountry Ovarian Cancer Alliance. Glad to have you with us.
Thank you.
And you're also a medical student yourself.
Yes, I am.
Where along this long path are you?
So I'm getting my MD PhD, so I'm getting my medical degree, but also my graduate degree. So I did the first 2 years of kind of the in-class portion of medical school, and I'm in the middle of my graduate degree. So I'm 5 years into a 8-year-long road.
Wow, well you're over the halfway part,
exactly,
so that's good. That's a huge accomplishment. And this is at MUSC.
Yes, exactly.
And they have a very strong cancer hospital. And I know that here in South Carolina, the statistics support that there are a lot of people who have been diagnosed with various cancers. But ovarian cancer is one that maybe you can outline for our audience, how prevalent it actually is, what causes ovarian cancer, and what are some of the signs and symptoms or contributing factors?
Sure, no, absolutely. So ovarian cancer, it's more of a rarer disease as far as in the whole scope of cancer, breast being the most common in women, but it has a higher mortality rate than breast. The research is kind of lagged behind. I think part of it is because it's not as common. So there aren't things like, there's no mammogram for ovarian cancer. A lot of women, when they go to see their gynecologist, they think that a pap smear covers that type of cancer, but it doesn't. So it's very important to be aware of the symptoms, and a lot of the symptoms we go by the 4 Bs. They're bloating, frequent bathroom trips, feeling full with a few bites, as well as kind of abdominal tenderness or belly pain.
Couldn't you go for a transvaginal sonogram or something like that?
Is that how you can definitely, if your doctor or physician has a high suspicion that this is something that they want to investigate, they can do a transvaginal ultrasound. They can also perform other imaging like CTs, but they have to, be suspicious of this having like an etiology of going on, that this is cancer is present, right? Yeah. So you as a woman have to kind of be aware of the symptoms, and I think that a lot of young women also attribute this as an older woman's disease. But we, as part of our board, I know several women who were diagnosed at 16 and even 19 years old.
I was going to ask, what is the average age that someone gets diagnosed?
So it's normally women who are in their 60s to 70s.
So what kind of support does this alliance offer women who either know someone who's been diagnosed with ovarian cancer or who's currently battling ovarian cancer?
So we have multiple different types of programs. One of ours is the Lunch Bunch Support Group. So once a month, we take women out to lunch, and they get to, and they're patients, current patients, survivors, and they're just sharing their experiences, what it's kind of like on the current chemo regimen that they're on. What do they think of this oncologist? How are they dealing with the side effects? It's just a really great time to bond and know that those other people are on the same path as you or have been there before. Yeah. The other thing that we do for newly diagnosed women, and this is for all gynecologic cancers, so ovarian, uterine, cervical, etc., we provide them with a teal tote. So this tote bag, it's full of wonderful things to kind of help women get through the discomforts that come along with chemo. So blankets, some treats, a letter that's kind of personally written from our board members, so that they know that they're not alone.
Support is just the most important thing, isn't it?
Absolutely.
And speaking of treatment, what is the typical treatment for ovarian cancer?
So it starts out usually with some pretty harsh chemotherapies that are kind of typical to what you kind of attribute to cancer treatment, that are infusion-based. Unlike breast cancer, for instance, there aren't any oral chemos available. There are some more targeted therapies, such as PARP inhibitors, but that's not normally, I think, what they start with.
And not radiology, or radiation, excuse me.
I think that those kind of methodologies have a place. Their surgery as well. A lot of women, they present with these very large masses of tumors, so they have to go through this thing, it's called debulking surgery. So physicians have to take out sometimes. One of our board members, she had a basketball-sized tumor actually present when she was diagnosed. Yeah, it's
basketball size.
Absolutely.
I mean, that's like as if you're pregnant.
That's one of the younger women who was diagnosed, the 16-year-old woman. She said that her mother actually thought she was pregnant. That's why they went into the gynecologist.
Oh my goodness.
They're very large tumors for sure.
Wow, and to carry that around with you, how painful.
Absolutely.
But to have it removed is a blessing. Well, you do have some events that are coming up in September. I want to make sure that we mention that September 10th and 20th, the Teal Arts Festival is happening. happening. September 14th, the second Sunday profit share with Kendra Scott on King Street.
Yes.
So make sure you head out there, show up. This is at On Dog Green is the first event.
Yes,
and then
for September 10th.
Yes, and then the second one is New Realm Brewing on Daniel Island. So make sure you go get your tickets, go out there, support, and you just never know. You know, you end up knowing somebody or
I think we all
self-diagnosed.
Yeah, we all know someone in our lives who's been diagnosed with cancer. So
fewer degrees of separation these days. Thank you so much for sharing with us, Caroline. Good to meet you.
Thank you.
We'll be back after this.